The Now's the Time Technical Assistance Center is pleased to be presenting a special Technical Assistance Learning Series for Healthy Transitions grantees focused on sustainability planning. In sustaining a program or effort, everyone knows that money matters. Kentucky's Healthy Transitions Initiative, Tailored, is exploring the use of financial mapping as a tool to enhance the sustainability of their initiative. I have with me today Kate Tilton, Tailored Project Director from the Kentucky Partnership for Families and Children, and Dr. Mary Armstrong, Executive Director of the Luis de la Parte Florida Mental Health Institute and Associate Professor at the University of South Florida's College of Behavioral and Community Sciences. In our conversation with Kate and Mary today, we're going to be learning about Tailored's experiences in financial mapping and related impacts on their sustainability planning efforts. So Kate, why did you decide to focus on financial mapping through Tailored?
Here in Kentucky, with a couple of previous initiatives, we had two different financial mapping reports completed that looked at spending for behavioral health services for children. And so with our grant, with the Healthy Transitions Grant, we're looking at the teens, the youth, and young adults. And so those financial mapping reports, they give us a lot of information, and we wanted to expand it up to 25. Our age range is 16 to 25, so that we could also see what was happening with the young adults in our state. What we were able to look at from the previous reports, we could see clearly that as kids turned to teens and then headed towards adulthood, they were dropping out of traditional mental health services and substance use services. So that was something very clear and very striking that we saw from the previous reports that we had completed. So we felt like it was very important for us to now look at what happens to those young people as they become young adults and up to 25. And then additionally, with Tailored, from the very beginning, we have made sustainability planning part of what we are focused on and heavily focused on. And so for us, the financial mapping is an important and integral piece to that.
Can you tell me a little bit more about financial mapping? How are you identifying those current financing patterns in Kentucky?
So when a site is interested in beginning the process of financial mapping, there are really 3 steps that need to be taken. And the first is to identify your target population. And that's pretty easy for the Healthy Transition sites because it is your target population for the project. So just like Kate already mentioned, for Tailored, it is youth and young adults between the ages of 16 and 25. And then the next very important step is that Kate and her team, including her youth coordinators, need to identify when the project ends, what are all the needed services and supports for this target population that we want to make sure that we sustain. So that includes services, supports. Sometimes it's positions like peer support specialists, which can be very difficult to fund in some states and communities. So that's the next step, is to identify who are all the possible funders of those services and supports. When Kate and I began working together, we both realized that there were probably funders that we have not worked with before in Kentucky that were going to be very important. And those for us, immediately we thought of the Department of Corrections and rehabilitation services. So Kate and I together went and met with folks at each of those state agencies, and they were clearly new partners. They were extremely interested in the project, and both of them have wonderful financial data systems.
How do you think financial mapping will be used to support sustainability in Kentucky?
What we're doing is we are gathering together data, and then also personal stories, just painting that full picture of what is going on in Kentucky as we move forward to really work to figure out how to help young people access services, and how to engage them and how to keep them engaged in services in a way that they can then reach their goals.
Once we've got all of the data collected and we've got those financial maps ready, then we bring together all the funders and we present to everybody together what we have learned. And one of the very interesting things that always happens in that process is oftentimes, even if funders are clear around the dollar amounts they're spending and for what, so some of them are very clear about that, but even if they know what they're spending, they're oftentimes clueless about what other folks are funding and are not funding. And so through that process, that's how you can begin to talking about, so what are the services that are not being funded or that Tailored Healthy Transitions is funding now, but we have to figure out how we're going to fund those in the future. And next step of an interagency meeting where everybody sits down together, looks at the maps together for sustainability.
Just to add to that, I think what we've seen with our drop-in centers and young people coming in, some of the major areas of, problem areas for young people walking into the centers are things like housing, employment, access to mental health care, wanting to continue their education, so court involvement. So being able to connect with those other agencies that are serving young adults, youth and young adults for those exact problems is going to really help us paint a clear picture for ourselves and others on, what we need to do next to transform things for young people in our state.
Thank you. And Kate, do you have anything you'd like to share based on your experiences getting started with financial mapping in Kentucky?
The first step for us was reaching out to some of those agencies that we previously hadn't connected to. An example for us was the Department of Corrections, because that's just an agency we had never interfaced with or really thought about as a service provider for mental health services or behavioral health services for young people. And so when Dr. Armstrong came to visit us, we went to the Department of Corrections and we're very excited to see that they gather a lot of data and that they were very motivated and excited to partner with us. Their goal is really to see less young people with behavioral health issues in their system. And so they were very excited to share data with us, to partner with us. And that surprised me. That was something I'd never thought of. And it was great to have just such a great new partner as we move forward to talk about where are young people ending up that have significant behavioral health issues in our state.
What could financial mapping offer to other states and communities that are considering this approach?
A lot of times when kids are young and having behavioral health issues, their parents are bringing them in. And then as they get towards adulthood, those services a lot of times are no longer appealing, have stigma associated to them. A lot of them have system fatigue, and so they're dropping out of our services that we have available and are offering. And then a lot of times they come back into our systems when they're, somewhere in their 30s. If other states want to focus and prevent that too, I think, again, painting that picture of what is happening through data and through the programs that you're providing, what young people are gaining from those programs. So that data piece, again, it's a very great part of the data piece to have the financial mapping, because working in as a service provider and in the system, what we know is going on, we need to see it. We need to see what is actually happening with the spending patterns. Where are those young people going? Because they're not just disappearing and not ending up in anyone's system for about 15 years. They are still being served, but elsewhere. among our agencies. So, like I said, I know that other states, it's the same or a similar problem that they are facing with how do we offer and provide services to young people in a way that they want to come in and want to receive those services and supports and want to keep coming back. So financial mapping is just helping us dig deeper into how we do that and how we can sustain the programs that we have that are meeting that need for young people.
All right, well, thank you both for joining our discussion today and sharing information about your sustainability efforts in Kentucky.
So please be on the lookout for other grantee featured videos in our Healthy Transitions Learning Series highlighting strategies to support sustainability.